He said, lately when I've been smelling cheeseburgers, I've been developing asthma attacks. I thought that was a rather strange symptom. So I asked him to imagine eating a cheeseburger, which is something he could not do in real life. And within seconds, he appeared to be having a terrible asthma attack. And I thought to myself, oh no, he might stop breathing. And I told him to stop it. And he did. And I said, you're kidding me. He said, no, I couldn't breathe. That was my asthma. I said, whoa, you could think your way into illness? If you could do that, can you think your way out? There's preconceived notions that Hollywood puts into our minds that hypnosis is evil or mind control or an act, which it's not. All hypnosis is self-hypnosis. The only mind control in hypnosis is you learning to control your own mind better. And you won't do anything in hypnosis that you wouldn't want to do out of hypnosis.
Dear Family is a podcast hosted by Rachel Steinman, a writer, an educator, and a mental health advocate. And Rachel gets us up close and personal, so we feel a strong connection, familiarity, and comfort with her guests. So settle in and join us as we search for true healing and journey with Rachel and her most interesting guests.
Hello, everyone. Welcome to another episode of Dear Family, the podcast. This is episode 101. So exciting to be in the 3-digit number. And speaking of numbers and 101, last episode was my 100th, but it really was like a mental wellness 101 course. And I'm calling it my Dear Family Graduate School. I share 40 universal wellness truths. So make sure to check that out. I know you are going to love this episode with Dr. Ran Anbar. He is so insightful. And the topic of hypnosis is fascinating because our minds are fascinating. And honestly, I cannot wait to be hypnotized. I also want to share something very exciting that happened with the mental health community. We've launched the 988 Crisis Lifeline. And when I say we, it's just I'm getting the word out. And it's a 3-digit mental health crisis line. And it means that more people can get the help they need by trained professionals. So rather than having to call 911 for an emergency, when you have an urgent mental wellness need, you can call 988. And it makes it really simple and easy to remember. And trained mental health professionals who understand the impact of mental health conditions can offer resources. So it's just a really exciting thing. So make sure you spread that word and know that that is there for you and for your loved ones. I want to thank you so much for listening to this podcast and also subscribing and following me on all the social media platforms at Right Now Rachel. That's right with a W. Word of mouth is fantastic. 5-star reviews are incredibly appreciated. But most importantly, I want to send the message that you matter and you are so important to so many people. So take care of your mental health. Know you are loved. Know that your mental health is so important. Asking for help is so brave. Part of mental health is finding coping mechanisms to enjoy your life. And that might mean getting outside, going on a hike, walking the dog, going to a concert, preparing a good meal. Whatever it is that brings you happiness and joy, I wish that for you. And without further ado, Dr. Ran Anbar is a pediatrician board certified in pulmonology, and he offers hypnosis and counseling services in La Jolla, California, and Syracuse, New York. He's past president, fellow, and approved consultant of the American Society of Clinical Hypnosis. And he's here today to discuss the power of hypnosis that's long been overlooked upon with confusion and skepticism. He shines a light on this underutilized field of medicine and why it should be the first line of defense before medication for mental health symptoms. With 25 years of experience, Dr. Anbar is a leader in clinical hypnosis who's successfully treated over 7,000 children. He served as a professor of pediatrics and medicine and the director of Pediatric Pulmonology at SUNY Medical University in New York for 21 years. He's worked as editor for the American Journal of Clinical Hypnosis and directed more than 20 clinic workshops on pediatric hypnosis. He's trained more than 1,000 healthcare providers, been the principal investigator in 10 published case studies of pediatric hypnosis, is involved in research trials of children with cystic fibrosis and other pulmonary disorders, and he's lectured all over the world. Dr. Anbar is a published author of more than 50 articles, abstracts, and book chapters on pediatric functional disorders and pediatric hypnosis. He's just published a book titled Changing Children's Lives with Hypnosis to help parents and kids and anyone interested in using hypnosis to increase their well-being. Welcome, Dr. Anbar. I'm thrilled to have you on the Dear Family podcast, and I'm really excited for you to help dispel some of the myths about hypnosis, because when I think back to learning about hypnosis, I think of when I was a teenager and I went to go see a hypnotist / comedian call someone up on stage and made him bark like a dog. And then when he came out of the hypnotic state, he didn't remember it. And it was more an entertainment value. And I want to know why it's an underutilized therapy. But before we move into that, I always love to start by having my guests tell us a little bit about themselves and their family.
I am a physician. I'm a pediatric pulmonologist who got involved in hypnosis about 25 years ago. In terms of my family, I am fortunate to have a lovely wife and 4 children. My oldest son just became engaged. Very excited about that.
Congratulations.
My daughter, who's the next in line, just bought her first house. And then I have 2 younger ones who are still in school, in college, and about to start graduate school. I'm very fortunate. I grew up in Israel my first 9 years. And then we moved to Chicago and then Palo Alto, California, where I went to high school. I've thought about how I started getting involved in spirituality and life matters. And I remember a couple of incidents when I was a kid. Once when I was 5 years old, I really wanted to go fishing. And I begged my father to take me fishing. And finally, he bought me a fishing rod and we went and I caught a fish. And the first thing I said is, put it back. I respected life back then. I also remember when I was 8 years old in Tel Aviv in Israel, we were walking down the street and a man had trapped some wild birds and was selling them for $1 each or the equivalent thereof. And I asked my mother for my allowance. And I bought 2 of the birds and let them go because setting it right. I saw early in myself elements of what now I'm doing day to day as part of my spiritual care through hypnosis.
You've been a pediatrician for 36 years, and you are the past president, fellow, and approved consultant for the American Society of Clinical Hypnosis. Since 1998, your experiences with hypnosis have allowed you to successfully treat over 7,000 children, adolescents, and young adults. What initially interested you in this type of therapy?
25 years ago, I was practicing my pulmonology, and a young man was referred to me. His name was Paul, and he was very allergic to milk products. And he had asthma as well. He said, lately, when I've been smelling cheeseburgers, I've been developing asthma attacks. I thought that was a rather strange symptom. So I asked him to imagine eating a cheeseburger, which is something he could not do in real life. And within seconds, he appeared to be having a terrible asthma attack. And I thought to myself, oh no, he might stop breathing. And I told him to stop it. And he did. And I said, you're kidding me. He said, no, I couldn't breathe. That was my asthma. I said, whoa, you could think your way into illness? If you could do that, can you think your way out? And I thought there was something about it. And indeed it was. This was the power of hypnosis that he was using. And I then became interested. In college, I was major in psychology and biology, and I was interested in hypnosis. And I offered to send him to a psychologist who could teach him hypnosis. He could teach me, but he didn't want to go to see a psychologist. He wanted to work with me. And I said, okay, but I don't know much about it. He said, I don't care, because he's a teenager. And I went to my local psychiatrist, my friend, who said he would back me up. And I started learning about hypnosis, which is how I taught Paul. And then later on started using this with many other patients.
It's really interesting that we can think our way into illness. As we know, stress is in of itself a huge factor that leads to illness. So why not think our way out of illness? As a pediatrician who has been involved in children's mental health, do you have any thoughts on why we are in the midst of such a huge public mental health crisis, with so many of our young people dealing with anxiety and depressive disorders and such a major increase in suicidality?
That's a great question. I think there are a number of factors. I think children growing up these days are facing stressors that we never faced in previous generations. The first one comes to mind is social media, which is so pervasive. It's really an experiment we're doing in our society. We didn't really think it through. We're just doing it. And it affects children in so many ways that increases their stress. First of all, they're always connected, 24/7, they're connected. They keep checking, keep up with their friends. They see things on social media that aren't even real, but seem real. Like they see postings of other kids being very happy and playing, and they feel left out and they feel anxious. They feel something is wrong with them. There's cyberbullying that takes place when kids interact, and you're 24/7 connected, so you can't even breathe. So I think that's a really big source of stress. And then there are global stresses that we're dealing with. The most obvious one right now is COVID, but climate change is something real that kids growing up today are concerned about. When I was growing up in the 70s, we were concerned about nuclear war. Now there's a little bit of concern about that as well. And so there's the pressures of political and social interactions. America in my lifetime has never been this divided politically. And this, of course, permeates to the kids. So a lot of stress is going on. And we don't live with family as much as before. We used to live maybe in the 50s and 60s. There was an uncle or grandfather in the house, aunt or grandmother that you could go talk to. Now people are living in small little units and maybe don't even only have one parent in the home, and kids don't have anyone to turn to. So there's nowhere to find relief. And I think that's part of why there's a lot more mental health issues.
I would also add that our kids aren't getting out and exercising to let that fight or flight energy out. They're sitting at screens more.
Again, the social media and the screens, absolutely.
I'm not sure if you've ever read the book by Bessel van der Kolk, The Body Keeps the Score, but he said that hypnosis was the most widely used form of treatment for trauma back in the late 1800s in the time of Sigmund Freud up until World War II. Why did it fall out of favor after that time period?
I'm not sure I quite agree with him. I think hypnosis was used for trauma in the late 19th century. I think Freud actually made it fall out of favor. Freud was interested in hypnosis early on, but he had a hard time using it. Freud was a very strange man. Do you know reasons people lie on couches for psychoanalysis? Freud did not feel comfortable looking into people's eyes. And he only had like 9 patients. He just worked with the same people over and over again. So he tried hypnosis. And in those days, very authoritarian style, you will fall asleep, you will do what I say. And people actually do not respond well to that. Some people do, but most people don't. So it didn't work in his hands. He dumped it. And so a lot of his followers dumped it, which is one of the reasons it fell out of favor. He actually was one of the causes. So it took until mid-50s when the modern hypnosis movement started. And what's interesting is, as early as the 1950s, both the American Medical Association and the British Medical Society said that hypnosis is a valid tool for pain control. And yet, still to this day, hardly anybody practices. When I went to medical school in the 80s, nobody talked about hypnosis as therapy. One of the reasons I wrote my book is to let the public know about what hypnosis can do. People have been trying to tell physicians what hypnosis can do for years, but it's falling on deaf ears. In part, it's because there's preconceived notions that Hollywood puts into our minds that hypnosis is evil or mind control or an act, which it's not. All hypnosis is self-hypnosis. The only mind control in hypnosis is you learning to control your own mind better. And you won't do anything in hypnosis that you wouldn't want to do out of hypnosis. But physicians may not know that. Physicians also don't have a pharmaceutical company saying, hey, prescribe hypnosis, because they think that you can't make any money doing hypnosis. And so people don't think about it. It should really be a first-line therapy, at least in conjunction with medical evaluation for most patients. Let me talk a little bit about that, if I may. So any individual with a chronic illness can benefit from hypnosis. That's more than half of this country. Let me explain why that is. When you have a chronic illness, it's going to affect your psychology. You might be anxious because of your symptoms. You might be worried they're going to flare up. You might be depressed because of them. They might affect your life and what you can do. And that affects your psychology, not in a good way. When you learn to do hypnosis, you learn to control your psychology better so your symptoms can improve, sometimes dramatically. And then there's a whole large segment of patients whose psychological issues causes symptoms. An example is a child is bullied in school and they develop stomach aches, or you have a tough boss at work and you develop headaches. Those kind of patients, when they learn to regulate their emotions, their symptoms resolve, they go away. And yet Western medicine is geared, oh, you have a headache, let me give you a pill. The pill isn't the answer. The answer is learn how to deal with your boss. And then there's no medicine necessary. And that's why hypnosis should be in the hands of everybody who could benefit, which is most of us.
How does a physician get qualified to administer hypnosis?
The beautiful part is that all good physicians use hypnosis, whether they realize it or not. When you're interacting with people and you're helping them become better, if you're a good physician, you've naturally learned to use language in a way that helps your patients. And some of that is hypnotic. For a good physician to learn to officially use hypnosis might take only 20 to 60 hours of training. The workshops given all around the country by some good societies. There's some societies or some organizations of hypnosis that'll teach anyone, but their societies are meant for professionals. And they teach 20 to 60 hours of training how to start using it on a regular basis within the practice. The more you do it, the better you get at it. This is true for individual patients and physicians. And it doesn't only have to be physicians. It could be nurse practitioners, it could be nurses, it could be social workers, it could be psychologists. Lots of healthcare professionals can learn how to do hypnosis and help their patients. And people can also learn to do hypnosis for themselves. I think it's a little bit harder to do on your own, but you can. And there are plenty of books out there telling you how to do self-hypnosis. But one of the keys for hypnosis to work is that you believe it can work. And so I think it's sometimes easier to believe when you hear from someone than reading it in the book.
If you're a cynic, will hypnosis work?
If you're willing to be open-minded, hypnosis will work. If you want to prove it doesn't work, then it won't work. Remember, all hypnosis, self-hypnosis. If you don't want it to work, it won't. Occasionally, I meet patients who just want to prove that this is not going to work, and it doesn't. I remember one girl came to see me. She had total body pain, incapacitating pain. And she came in and said, nothing has helped me, and hypnosis is not going to help either. But teach me anyway. This was early in my career. I probably would refuse to teach her at this point because I would know it wouldn't work. But I said, okay, I'll go through the motions with you. We did it. And by the way, to teach hypnosis does not take a long time. You just learn how to focus on, for example, a calm place. Use all your senses. What can you hear and see and feel and smell and taste? In so doing, you get into a calmer state, and that's a hypnotic state. And then you learn how to trigger that when you need to calm yourself. So I taught her how to do that. She came back the next week, and she was no better. She said, I told you it wouldn't work. So then we had a conversation, and after talking for a while, she said, 95% of me wants to get better, but 5% does not. Why doesn't 5% of you want to get better? Oh, the pain is part of my identity. I ask my patients often, if you had one wish, what would you wish for? She said, I wish my mom would have more money. This is a girl who's incapacitated by body pain. Her wish has to do with her mom. So it tells you sort of her mind is not helping herself heal. In fact, I suspect her pain was a way of expressing herself and controlling her environment, and she wasn't going to let it go. And hypnosis was not going to work for her.
It's really interesting. I've never been hypnotized, but I have done deep meditation and yoga, and I've gotten to the point of shavasana where my body is so relaxed. Is that kind of like the state that you're in?
Yes, it can be that. There's a clear overlap between hypnosis and other mind-altering practices. I disagree with you. I'm sure you've been hypnotized, at least by yourself. You've daydreamed before, have you not? Daydreaming is a form of hypnosis. You might have driven down the highway 3 miles and said, that's hypnosis. So hypnosis is not something formal necessarily. It does not involve a pocket watch dangling in front of your eyes. There are many forms of hypnosis. And yes, you can use hypnosis to get to that kind of state of mind that you just described with meditation.
You just dispelled a few myths. One is that it doesn't take a pocket watch and that you don't need someone to get you in that mind frame. Are there any other myths that we should be aware of?
I think that the biggest myth we haven't talked about is that hypnosis can cause something bad to happen. Hypnosis is a state of mind. So can you do something bad with hypnosis? Sure. Just like you can do something bad with your 2 hands. Can you do wonderful things with hypnosis? Sure. And I teach patients how to help themselves with hypnosis. When I was publicizing my book, as I still am, I posted on Next Door Neighbor that I'm having a book signing. And some troll got on and said, a quick search on the internet showed that a lot of child molesters use hypnosis. And I responded, well, there's a lot of misinformation on the internet. If you want to know what hypnosis does, you can look up some reputable websites. And he responded, a lot of arrests as well. And I think that's part of the misconceptions. Have bad people used hypnosis or has been implicated in badness? Yeah, sure. But money has been used for corruption. Does that mean we shouldn't use money? Hypnosis used well helps people do amazing things that they don't even realize they can do.
You mentioned earlier about Hollywood using it because it's an easy narrative for them to come up with mind control, but it is you controlling your own mind. And I think that that's something that needs to be reiterated. Why are people more receptive to suggestions when they're in a hypnotic state?
Great question. So the thought is that when you're in a hypnotic state, you're parking your conscious mind. So let your conscious mind be occupied with a thought, and that allows your subconscious mind to be more active. And when a suggestion is made, the conscious mind doesn't interfere by saying, that's impossible. The subconscious mind does what it can do to follow the suggestion. For example, let's say you come to see me because you're afraid of having blood drawing. And I say to you, well, why don't you numb up your elbow? And you say, what? I can't do that. But if you're in hypnosis and they say, numb up your elbow, you'll do it. And how does that work? Because you have the capacity in your mind to think of pain differently. Some people who are good at hypnosis can make it seem like they don't feel pain because they learn to disregard it in their minds. So the suggestions make it numb can work in hypnosis much more easily than consciously, because then you're going to say, I can't do that. That's not possible. So many things in our lives, we limit ourselves by thinking that's not possible because we're raised that way. You're taught this is reality, this is not reality. But the truth is that the reality is much more amazing than we realize. And that goes from numbing up a limb to maybe seeing a spirit. All over, there's a wide range of things that we think are not possible, and yet maybe they are.
I think it's so fascinating to hear this from an MD who's done research saying that you have to open up your mind on a spiritual level. How does hypnosis differ from EMDR, which stands for eye movement desensitization and reprocessing?
In my mind, the idea in EMDR is that by moving your eyes backwards and forwards quickly or alternating different sensations in the body, that it allows subconscious material to surface. I would propose to you that the reason subconscious material surfaces is that because the suggestion is made that subconscious material will surface. And I think that when you do the rapid back and forth, you're occupying the conscious mind. So I think that's what's happening. It's just a form of hypnosis. I have taught patients how to directly interact with their subconscious. The book that I'm on tour now is called Changing Children's Lives with Hypnosis, A Journey to the Center. And I'm telling you stories from that book. But I'm working another book, which is tentatively called Partnering with Your Subconscious, where I'm going to teach people to interact directly with their subconscious as a way of gaining insight without EMDR.
It sounds a little bit like EMDR is a little bit like rapid eye movement, like when you're dreaming, and hypnosis sounds a little bit like lucid dreaming, or it feels like it to me.
Yes, there's definitely overlap because when you're dreaming, you're dealing with the subconscious. Again, when you're doing lucid dreaming, you're dealing with the subconscious. These things all overlap with one another.
You incorporate clinical hypnosis into your medical practice. What medical and emotional conditions have you been able to treat?
Every chronic condition. The common ones I treat are children with headaches, with stomach aches, with shortness of breath, bedwetting, anxiety, and depression. But really, any chronic condition. I was called by a pediatrician mother about her young man who was about 12, and he rode on a roller coaster. When he came off the roller coaster, he could not walk, and he was in a wheelchair, and they went to the hospital in the emergency room and was seen by an ear, nose, and throat doctor. They said, you injured your inner ear, and so you lost your balance. It'll take a while to heal. And she called me after about 3 weeks of this and asked, can hypnosis help a patient with this particular condition? And I said, sure. Because I believe as long as the patient is willing, hypnosis can help anyone. I'm not saying cure anyone, but help. So I met the young man. He says, I have to get better in 10 days. Why in 10 days? I have a Model United Nations competition that I have to attend. I've been working on it for half a year. I said, okay, we'll give you a crash course. So the first day I met him, I taught him how to use positive talk. So positive talk is phrasing things in a positive way because how we think is how we manifest things. what we say is what happens to ourselves. So I taught him to do that. And by telling himself, I want to be able to walk, he was able to stand up and sort of waddle across the room. And then 2 days later, my nurse practitioner, and we worked together because I didn't have time on my schedule, taught him how to do hypnosis, how to relax himself. He did that. With the relaxation, he was able to walk a long distance with it. 3 days later, he came back and I taught him how to interact with his subconscious. And I asked the subconscious, do you know why he's having trouble walking? He said, yes. And I said, can you tell me why? He said, it's too complicated. I said, can you fix it? He said, yes. I said, go ahead. And then he was able to walk fine. He danced in my office. He went to the Somali United Nations competition and won the silver gavel. And there's actually more to the story because we found out later what the issue was. But the point is that I didn't know for sure how it would help him. I didn't know he'd be able to walk so fast, but I was sure I could help him some because his psychology was involved.
When you say you interact with his subconscious, how do you get him into that hypnotic state? And then how do you interact with it?
Great questions. Actually, a simple way is to have somebody put their hand on a flat surface and ask their subconscious, when you're ready, please raise one of your fingers that would represent yes. And another finger would represent no. And the third finger represents I don't know. And once the fingers are raised, you know what you can ask yes or no questions. That's a simple way. I don't even use formal hypnosis anymore. I mean, the hypnosis there is to put your hand and don't move your fingers on your own. Let it happen by itself. And it's as simple as that. With older people, I might say, okay, go to a relaxing place in your mind and relax for a while. And then we'll do the finger things to make me more formal. But with kids, you don't even have to do that. You just put out your hand. And that's a simple way of talking to the subconscious. Another way is to imagine a whiteboard or a blackboard, depending on your age, or a computer screen. Imagine something could be written on, and then ask your subconscious to write the word hello on it. Ask it, can I ask you questions? Yes or no? And if it says yes, you can then ask yes, no questions, or you can ask more elaborate questions because they can write an answer for you. So that's another way of interacting with the subconscious. There are many other ways, by the way, but those are two.
I'm so fascinated, truly. I'm assuming hypnosis is a great therapy for people that are dealing with post-traumatic stress disorder that might not be able to talk about it because it triggers anxiety. Have you found it to be beneficial? And do you have an anecdote?
It can be very beneficial for people with PTSD, but this is where it's important you work with a therapist who knows what they're doing, because if you do hypnosis and you have a patient think back to their traumatic event, you can re-traumatize. You have to do it very carefully. You could do things like have the patient imagine the traumatic event on a movie screen and then have them change the movie from color to black and white, or turn down the sounds, or shrink the screen. All ways of mastering the memory. Another method is to help them imagine going back to the trauma time in a safe way, like on a movie screen or on a TV screen, and then imagine that they knew hypnosis at the time that they were traumatized, and to use hypnosis to calm themselves during initial trauma. And that seems to make a big difference for a large number of patients, that kind of therapy. They've shown some studies recently that patients who are in traumatic situations, if they're given propranolol, which slows their heart rate and lowers the blood pressure, keeps people calm during the traumatic exposure, that they are less likely to develop PTSD symptoms. And the reason that people think this is the case is that when people remain calm during a traumatic situation, they don't set up the same kind of triggers in their body that they might have otherwise. And I think when you do hypnosis in your memory and you calm yourself in your memory, you maybe have the same kind of effect.
I think the appeal of hypnosis is that there's no medication needed.
Correct. And sometimes hypnosis is a good adjunct to medication. But you're right. Oftentimes when people don't get better with medications because the answer is in their psychology. And Western medicine often forgets that there's a head connected to the body. These are the people who then go into alternative medicine routes, go into acupuncture and yoga and acupressure and biofeedback. Unfortunately, they don't often go to psychologists. And when they do, the psychologist sometimes is scared off by the symptoms. Whereas if you approach the mind and body as a whole, and you teach the patient how to regulate themselves, I can tell you the majority of people get better and sometimes a lot better.
I've recently been learning about dissociative states and how that's our body's way of dealing with these traumatic events. Is hypnosis a good therapy for someone that feels disassociated?
Hypnosis can be good therapy for someone who feels disassociated, but again, you got to work with a therapist who knows what they're doing. I think of hypnosis as a dissociative state, period. That we dissociate the conscious from the subconscious. It's not pathologic in that we all do it to start with. It becomes a pathology when you can't control the dissociation, or you're not aware of it and it's interfering with your life. One of the things I learned over recent years is that things that we think of as psychiatric disorders are really on the continuum with normal. So, for example, everybody gets anxious. You have an anxiety disorder if your anxiety is at such a level that you can't function well. Everybody gets sad. You have a depressive disorder if you're always sad and can't get out of it and interferes with your life. A lot of my patients, not a majority, but a significant number of patients have hallucinations, I've found. Usually people think if you're hallucinating, you have psychosis or you're schizophrenic, something like that. I don't think so. I think just like everything else, if you have hallucinations, which we can debate, what are you really seeing? I think that can be perfectly normal. It's not a disorder unless it interferes with your life. So even something like psychosis, if it doesn't interfere with your life, it's not a pathological issue.
I volunteer for NAMI and I go into middle schools and high schools and I do a program called Ending the Silence. And we talk about the difference between feeling sad or feeling anxious. That's totally normal. It's about the severity and the duration. I do think that's a really good point about how you can have a hallucination and it doesn't mean you're psychotic. I've had moments where I wake up from a dream and it's that in-between period where my mind is switching and I've seen things and it's really a fascinating moment. It hasn't scared me, but I could see it potentially scaring somebody.
Right. And if they go to a physician or a psychiatrist for that matter, who's not well-versed, they might say, oh, this is bad. And then,
right. And then that causes more anxiety.
And then medications with side effects, and you've gone down a really bad path. I work with one 14-year-old who had 4 demons chasing after him. He would see them in the shadows in school. They frighten him. But demons or hallucinations don't scare me. You just have to sort of deal with it. And the way you deal with it, in this particular kid's case, is we talked to the demons through him. I didn't see them. And find out what they wanted and address the needs. And then they went away. And they haven't occurred since. I actually still follow him. It's been 6 years. He's fine. But I've talked to psychiatrists about him, and I am positive that if he had seen a psychiatrist who would say, oh, those are clearly hallucinations, that your mind is in bad shape, we're going to put you on zombie medication or antipsychotics, his life would have been derailed at that point. And my psychiatry friends agree with me that this happens out there. And I think people need to be very mindful of that even for things that are really disruptive, because the demons that interfere with his life, they can go away with psychotherapy, not with medication.
It's hard for people to hear because you have to acknowledge those demons in order for them to go away. You have to acknowledge that you're feeling anxious. Otherwise, you bottle it and it's going to explode.
So you don't tell anyone because you're afraid they'll think you're crazy. And then you're not dealing, that doesn't help you deal with it.
I really appreciate that idea. Let's try to come to it at a point where you're helping your patient acknowledge it and not just medicate it. And that brings me to the next question. How can parents work directly with their children to help them continue this type of hypnosis logic so that it continues in their interactions and their relationships on a daily basis?
In my book, Changing Children's Lives with Hypnosis, every chapter ends with what you can do on your own section, where we take these hypnotic ideas and use them in our day-to-day life. So, for example, the ideas we've talked about so far that parents can use is learning to be positive with their children, teaching their children how to be positive for themselves. So rather than telling a child, you're very lazy about doing your homework, you might tell your child, I believe you could be a lot more industrious in doing your homework. Rather than telling your child that was a really stupid play on the field, tell your child, I believe in you. I know you can improve with practice. So just reframing how you approach your child can go a long way in helping raise a well-adjusted child. We talked about ways of calming yourself. If a child is anxious, they can be coached to think about a calm place. They will calm down. You can teach a child breathing techniques to help keep them calm. You can teach a child to quiet their mind and just listen to their inner wisdom, and then listen, not only have the child listen to their inner wisdom, but you as a parent, listen to what your child has to say. And then don't say that's stupid. Whatever they say, respect it. We talked about the demons a few moments ago. I didn't say that was stupid or that's not real. I treat it with respect. We talk to the demons. We find out what they wanted. We address that. And when you treat your children with respect, they live up to that respect. And then, of course, they treat you back with respect. And that's things you can learn from hypnosis and just put day-to-day to practice without use of a therapist.
You are a pulmonologist, and you've done research trials on children with cystic fibrosis and other pulmonary disorders. What's the new research? Is there anything exciting to know? Any improvements?
Cystic fibrosis, we've made major league improvements. When I first started working in this field 36 years ago, the average person with cystic fibrosis lived to be about late teens, like 19. And since my career started, people are living into their late 40s. They have medications now that actually treat the actual defect of cystic fibrosis. And when they're given to a young child, they may actually allow that child to live a normal lifespan, which is amazing to see that kind of transformation. When I first started working in the hospital, every day there'd be 10 or 12 kids with cystic fibrosis hospitalized for intravenous antibiotic therapy. These days, nobody's hospitalized. Major league change. In the field of asthma, there's also been a lot of improvement in asthma care. During my career, we've introduced inhaled steroids as a standard of care for patients with asthma. And again, we don't have people who are coming to the hospital all the time because of asthma. In fact, if you treat asthma well, you should never have to go to the hospital. In the old days, kids were in the ER in the hospital all the time with asthma flare-ups. So there's been major progress in the last 3 decades in both of those areas.
I am sure you would say that as far as asthma goes, controlling stress is also very helpful.
Absolutely. So back in the early part of the 20th century, asthma was thought to be a psychosomatic disease solely, usually the fault of the mother. But we moved past that, and we learned in the later part of the 20th century that asthma involves inflammation and spasm of the airways. But here in the 21st century, especially with my work with hypnosis, I've learned about how the psychology of asthma does play a major role. I told you about my very first patient whose asthma was triggered by imagining eating a cheeseburger. So I taught all my patients with asthma how to do self-hypnosis, and some of them got a lot better. I remember this one girl, she came to see me at 12 years of age. She had very bad asthma, so bad that she had been treated with oral steroids for 10 years. Really bad news when you're given for a long time. Inhaled steroids are fine, but oral steroids have a lot of side effects. They make you short, make you overweight, hunch over your back, give you acne, brittle bones. She had all of those things. But every time the doctors tried to take her off the steroids, she ended up in intensive care unit 6 times, almost dying from asthma. So they were afraid of taking off the steroids. So when I met her, I taught her how to do hypnosis. And she said, oh, this works better for me than my rescue inhaler, my albuterol. And so then I started weaning her off the steroids slowly. It took a year. Half a year into this, she was in the intensive care unit again. At the same time, her mother was undergoing a hysterectomy. The psychologist audience can think about that. But I didn't panic and put her back on the steroids. I said, well, just calm yourself and we'll keep going. After a year, we got her off the steroids. In fact, she stopped all her asthma medicines at one point. I had to yell at her because she did have some moderate asthma for which she needed treatment, but she never needed steroids again. And this is an example of a child who was made a medical cripple because people didn't address her psychological needs. So a lot of her asthma was psychologically triggered. And when she learned to control her psychology, her asthma got 80% better.
When you're panicked, your heart rate speeds up and it causes your breathing to get more shallow. It's all tied in. And I'm sure that that's very much a part of hypnosis.
Just to clarify about that. So if you have an asthma flare-up and you go to the emergency room and then you're scared because you can't breathe, then that creates more trouble breathing. Then they give you medicines and you get only a little bit better because the trouble breathing you're having is not just from asthma, it's from your panic. So you get only a little better, so you panic even more, and they give you even more medicine, and the doctors are panicking and you're panicking, and suddenly you're in a bad cycle. And you can break that by learning how to control your emotions.
Let's talk about your very well-received book, Changing Children's Lives with Hypnosis, Journey to the Center. I'll have the link in the show notes. Tell us who your book is geared for, some key takeaways, and something you learned writing it.
The book is geared to the public. The reason is that there have been plenty of books written for physicians and mental health professionals, and that has not moved the needle in terms of access to hypnosis. So my hope is by writing the book for the public, people will realize how hypnosis can be so powerful, ask for people to help them for themselves, but also tell other people about it. I'm hoping this will start a grassroots movement that will increase the visibility of hypnosis. As I mentioned earlier, every chapter ends with, this is what you can do on your own. So even if you're not going to do hypnosis formally, I think you can learn a lot from the book. And while the book is entitled Changing Children's Lives with Hypnosis, because I'm a pediatrician, it really applies to everyone. Everyone can learn skills from that. And I've had readers come and tell me, oh yeah, I've been using this in my own life, adult readers telling me that. What did I learn as part of writing the book? Well, I learned to think about different aspects of what I teach. I teach about the subconscious. I teach about spirituality. I became more aware of how having a spiritual perspective is healing. I talk a lot about that. And also, now I'm learning as an author how difficult it is to spread a new idea. And unfortunately, it's a new idea. It shouldn't be a new idea, but it is. And the challenge of doing that, I'm hoping the listeners to this broadcast can help spread the word and carry on this part of their mission.
I'm very grateful to learn more about it, and I'm sure so are my listeners. I am at the point in this program where I ask my guests the same two questions. If you could write your younger 20-year-old self a Dear Ran love letter, knowing what you know now, what would you tell yourself?
I would tell myself that you should recognize that each one of us has tremendous resources inside of us. And that as you move forward in life, remember to listen to yourself, to trust your inner self, and find ways of accessing that wisdom that you can help pass along to others. I would want me to become more aware of the vast possibilities so I can get a leg up on the stuff that I've learned to do.
You're advising yourself on what you're advising others now to do. Do you have any happiness habits? What brings you joy?
My career brings me joy. I love helping people. I'm all about helping people feel better. I love writing. I just came back from a week vacation, the first vacation I've had since COVID started. It's almost 3 years. And what did I do in vacation? I read 6 books. I wrote a blog. I had an interview with a reporter. I had a book signing where I talked about hypnosis. And my wife said, I thought you were vacationing. I said, yeah. When I was a kid, when I had free time, I would read and write. And I still do. So that's what brings me happiness. And I'm so fortunate that in my career, every day, I don't work. You know, you've heard this phrase before. If you love what you do, you never work a day in your life. And that's very, very true. I'm in the office 6 days a week from 7 to 7. Every moment is precious. I eat meals with my patients. Sometimes I invite patients to meals. I did that because I remember when I was growing up in college, a professor would take me out to lunch and it was so meaningful. So I recreate that for my patients. And it's just a joy to be with them. So that's my answer.
That is rare. That is a true blessing. Well, this has been so enlightening. I now want you to hypnotize me. I'm sure so do all my listeners. Thank you so much. I wish you all the best. Congratulations on your son's engagement and all the good things.
And thank you so much for allowing me to share my story with you and your listeners. And I hope that you will take my challenge and help spread the word. So
I absolutely will. That's my goal. Well, thank you. It's so nice meeting you, Dr. Anbar.
Pleasure.
Okay, you take care. Okay, thanks.
Bye-bye.
Bye. This is Rachel Steinman. For more information or to contact me with any questions, comments, or guest ideas, please check out rightnowrachel.com. That's right with a W. Thank you so much for listening, subscribing, and sharing, dear family. And if you found value in what you've just heard, I would love and so appreciate a great review on Apple Podcasts, Stitcher, or wherever you listen to your podcasts. Until next time, I wish you love, happiness, and good mental health.